Hi, I'm Chuck Gehring, President and CEO of LifeCare Alliance. In our 120th year of existence, LifeCare Alliance serves over 20,000 Central Ohio neighbors through nutrition and healthcare. The agency succeeds today through the support of dedicated volunteers, community partners, and generous donors, and is a national model for programs of its kind. But before we look further at where we are today, let's take a look at where we have been.
It all began on February 9th, 1898, when Catherine Nelson Black, wife of then Columbus Mayor Samuel Black, gathered 18 friends in her home to discuss her concern about the sick and poor in the community, as well as the extremely high rates of maternal and infant mortality. Those women formed the Instructive District Nursing Association with one simple goal: to take care of those nobody else pays any attention to. At the turn of the 20th century, the IDNA became the leading healthcare agency in the Central Ohio community. When typhoid, tuberculosis, and polio struck, the IDNA formed the frontline defense. Nurses made thousands of house visits each year and established the baby's milk dispensary to prevent the numerous diseases transmitted through contaminated milk. The IDNA also established the Columbus Baby Camp in 1908 with funding from the Columbus Evening Dispatch. The camp would go on to care for over 1,500 sick babies in its 24-year run and brought groundbreaking awareness to proper sanitation and cleanliness. Later, in 1913, when floods ravaged the bottoms of Columbus, the city entrusted the IDNA's director, Jane Tuttle, to command relief efforts, having police, firefighters, and all other first responders report to her. Moving into the Roaring 20s, the IDNA became a charter member of the Community Chest, known today as the United Way. The nurses upheld the daily mission of helping those in need and became known as the Angels of the Back Streets. During the Depression, the IDNA established an Emergency Consultation Crisis Center at its headquarters and hired the agency's first nutritionist to teach individuals how to best use their food resources. As time moved on, the Instructive District Nursing Association continued to progress. Mental health professionals were employed in the 50s, and the first physical therapist was hired in the 60s, which led to the formation of senior citizen clinics, now known as wellness centers. In 1972, the IDNA renamed itself Community Health and Nursing Service, and in the following year, CHNS launched its first nutrition program called Food for Elderly People, the second Meals on Wheels program in the nation. In 1975, the agency developed its homemaker program, now known as Help at Home. Throughout the 80s, the agency opened up senior dining centers around Columbus, offering social and educational opportunities while serving nutritious meals. In 1987, the agency adopted the name LifeCare Alliance, a new name that would encompass the agency's ability to provide care through an alliance of healthcare professionals, volunteers, and programs. Moving closer to the 21st century, LifeCare Alliance streamlined operations by relocating to West Mound Street, which houses administrative offices as well as a commercial kitchen in the same location. This move bolstered the agency's ability to produce more meals, and it served over 1 million meals for the first time in 1993. This ushered in a new era of expansion for LifeCare Alliance. Asian and Somali dining centers were established, and in 2002, the agency ran its first healthcare clinic staffed by a nurse practitioner. LifeCare Alliance also strengthened its brand identity by introducing new logos, colors, and an icon named Spirit. The spirit of LifeCare Alliance was infectious. Soon after the rebranding, the agency began to expand and merge other life-nourishing programs into its operations. From 2003 to 2014, the agency's Meals on Wheels program expanded to include Madison, Marion, Champaign, and Logan counties. In 2004, Project Open Hand Columbus, an agency serving the needs of those with HIV and AIDS, merged into LifeCare Alliance. This was rapidly followed by the merging of the Columbus Cancer Clinic, which was founded in 1921 as the first free cancer clinic in the country. During this era, LifeCare Alliance began serving over 6,000 meals a day and increased revenue through its first two social enterprise initiatives, LA Catering and Corporate Wellness. As the demand for services continued to grow, LifeCare Alliance embarked on a successful capital campaign in 2006 called Time to Deliver, which entailed purchasing and renovating a nearby warehouse at 670 Harmon Avenue. The new facility would become the site of all meal distribution, including a chronic illness food pantry called Groceries to Go, and a full-service catering event center. LifeCare Alliance cut the ribbon on the new facility in 2008, and in 2009 opened its flagship dining center, Carrie's Cafe, a Harmon Avenue hub for food, fellowship, and fun for both older adults and the public. The Harmon location also gave the agency a space to launch its senior pet care program that assists clients in caring for their pets by organizing veterinary visits and by delivering pet food and supplies directly to clients' homes. Then came the recession, but the foresight that had launched social enterprise and welcomed merger partnerships proved instrumental in the agency's ability to serve all those in need and continue expanding services. In 2011, LifeCare Alliance welcomed Impact Safety, a program that teaches interpersonal safety skills and self-defense. The agency's business model would not only ensure its stability in the midst of difficulty, but it would also set a precedent for future success. In March of 2017, LifeCare Alliance welcomed its newest merger partner, the Central Ohio Diabetes Association. This strengthened CODA's ability to serve families through its signature camps for children with diabetes and expanded its reach to serve thousands of older adults living with or at risk of diabetes.
Which brings us back to today. At our 120th anniversary, LifeCare Alliance is an exception amongst organizations of its kind, maintaining a staff of over 130 full-time employees, 120 part-time employees, and a core of more than 7,600 volunteers. Our programs now annually serve over 20,000 clients, most of whom live on a Social Security check of less than $1,000 per month. And with each new partnership, LifeCare Alliance is able to serve its clients more fully, nourishing the human spirit. The impact of these efforts is astounding. Through our programs, LifeCare Alliance keeps people safe, independent, and in their own homes, while saving Ohio taxpayers over $1 billion each year through the savings that come from in-home care versus the cost of assisted living or nursing home care. As the need for our services continues to grow, and as traditional funding sources continue to erode, LifeCare Alliance has been able to serve all those in need without a waiting list. How is this possible? Well, since 2001, the tenets of the agency's success have grown to become the new nonprofit model that includes social enterprise, merger partnerships, volunteer engagement, fundraising, and building an endowment. In order to continue serving all those in need, regardless of their ability to pay, LifeCare Alliance's goal is that fundraising and social enterprise should make up 50% of our agency revenues. To put this in context, the revenue from social enterprise and fundraising has gone from roughly 1% in 2001 to 42% today. Volunteer engagement is also critical to reducing costs and builds mutually beneficial partnerships with corporate and community groups. The success of LifeCare Alliance has truly been an effort of many hands, minds, and partners working together to achieve great things. And the future beckons with a similar call for commitment. This year marks not only 120 years of serving Central Ohio, but also launches an unprecedented opportunity for the agency to secure its future for decades to come. With a generous $5 million match from an anonymous donor, LifeCare Alliance renews its Legacy Endowment campaign with a goal of building its current endowment to a total of $20 million. Our rich history of compassion, service, innovation, and excellence sets the backdrop of who and what LifeCare Alliance is today. It causes us to give thanks for the vision and revolutionary work of our founder, Katherine Nelson Black, who vowed to take care of those nobody else pays any attention to. And it causes us to look ahead and see that it's time to deliver our future.